There are several hundred proteins in our plasma. Out of these, only the very specific proteins I will mention today. Now, what is plasma and how does it differ from blood? Plasma is the non-cellular portion of the blood. That means whole blood minus cells. Cells means RBC, WBC. The cellular, apart from cellular component, there are fluid compartment. Fluid component of blood is known as plasma. It is the plasma. Now, again another word, that is serum. What is serum? How does it differ from plasma or blood? Which component will be minus from the plasma? Only one factor, that is fibrinogen. Fibrinogen, that is plasma minus fibrinogen, a plasma protein, that a clotting factor is equal to serum. For some estimation, we require whole blood, but most of the biochemical investigations require either plasma or serum. Plasma contains fibrinogen, but serum does not contain fibrinogen. Now, how will you get plasma and how will you get serum? Serum and plasma, you take the whole blood, with a substance anticoagulant. Blood with anticoagulant. You take blood with a tube, in a tube containing anticoagulant, heparin, sodium fluoride, oxalate, citrate, these are anticoagulants. Whole blood with anticoagulant. You centrifuge. Centrifuge মানে rotate করা in a machine known as centrifuging machine. Then cellular part will be in the bottom and the upper supernatant portions will be clear. But the upper supernatant portion will be plasma. এটা হচ্ছে প্লাজমা, এটা হচ্ছে সেলস। Plasma is the 45 to 55% of the total blood. 45 to 55% of the total blood is the plasma. Plasma is the clear supernatant fluid, not crystal clear, a slight reddish tint, slight reddish color above the cells. The supernatant fluid is the plasma. This is plasma. Now, what is serum? You will get serum from blood without anticoagulant. First, with anticoagulant, we get plasma by centrifugation. Without anticoagulant, by centrifugation, you get serum. Without anticoagulant, you get serum, and when fibrinogen is added to serum, it will be plasma. Fibrinogen, if added to serum, it will be plasma. That is, fibrinogen here utilized for clot formation. Here there is a clot containing cells. Clots contain fibrinogen along with cells, and the supernatant portion, it is the crystal clear, watery color. Plasma is the some reddish, but serum is crystal clear. So how does it differ from serum and plasma? I think you understood. This is a very basic thing: whole blood, plasma, serum. Now, I will talk about the proteins and their quantity present in the plasma. I have told that several hundred proteins are present in the plasma. Some are in significant amounts, some are in very minute amounts or trace amounts. And the three major proteins are present in the plasma. What are the three major proteins? First is the albumin. Any question? Albumin. Albumin is a major protein in the plasma. All of you have heard of the albumin. Albumin is a major protein. More than 50% of the total protein is contributed by albumin. Majority of the proteins are albumin. And next is the globulin. And next is the fibrinogen. These are the three major proteins present in significant amount. Except these three proteins, there are many proteins. But these are prominent proteins. Now, now I will describe about the concentration. What will be the concentration? Total plasma proteins is the 6 to 8 gram per dl. dl means 100 ml. 1000 ml is liter. So 6 to 8 gram per dl and 60 to 80 gram per liter are same. We express any concentration in per dl, either gram per dl or milligram per dl or microgram per dl or picogram per dl. The proteins present in the microgram per dl or picogram per dl I will not mention here. Proteins present in abundant quantities I am just mentioning. And Plasma proteins means essentially plasma proteins means these three components. Greater component is the albumin and the lesser components are the globulin and fibrinogen. Albumin being the greater component, its concentration is the 3.5 to 5.0 gram per dl. Out of 6 to 8 gram per dl, that is total protein concentration, 3.5 to 5 gram per dl is the albumin, which constitutes the majority of the total protein, more than 50% of the total protein. Next is the globulin. Its concentration is little lower than albumin, 2.5 to 3.5 gram per dl, and it is very little in comparison to albumin and globulin. It is 200 to 400, not in gram, but milligram. These are the concentrations of the various proteins present in the plasma. Albumin, major protein, next globulin, next fibrinogen. Out of these, albumin is the prominent protein and major functions is performed by albumin. What are the functions of the albumin? I am describing. Now first of all আমি classification গুলো শেষ করছি. Classification, I am trying to finish the classification and next I will describe albumin. Now globulin are of alpha 1 globulin, it may be alpha 2 globulin, it may be beta globulin, it may be gamma globulin. There are 4 varieties of the globulin: alpha 1, alpha 2, beta, gamma. These alpha, beta, gamma are represented by pattern of electrophoresis, pattern of separation. Separate করলে পরে প্রথমে অ্যালবুমিন পাবো. First of all, we get albumin towards anode. তারপরে alpha 1, alpha 2, beta and gamma. Fibrinogen is very little. It is beta, within beta and gamma there will be fibrinogen. Electrophoresis will be taught in the separate class. I am just mentioning in short. This is electrophoretic plate. Electrophoresis is a technique of separation. Electrophoresis is a technique of separation of the various biomolecules. In case of, this is the serum electrophoresis. There are 2 poles. Edicta anode. Anode means positive charge. Cathode means negative charge. Sample will be applied towards cathode side. This is the sample application site. That is serum. Sample application site. You take the sample in a pipette and you draw a line with sample. Then electrical separation will occur. Albumin being the most negatively charged. Highest negatively charged molecule is the albumin out of these 3, and obviously it will go towards anode, because albumin, if negative charged, it will go to the anode. Then it is the first, there will be albumin. Albumin. Next is the alpha 1, alpha 1, alpha 2, beta and the gamma. Albumin alpha 1, alpha 2, beta, gamma from anode to cathode. From anode to cathode, the band will be albumin first towards the anode, most anodic is albumin, and most cathodic, that is towards cathode, will be gamma. Based on these separation techniques, alpha, beta, gamma are represented here. Alpha 1, alpha 2, beta, gamma. Again gamma or এটাকে বলা হয় immunoglobulin. Gamma globulin is known as immunoglobulin or antibody. Immunoglobulins are known as gamma globulin. Another name of immunoglobulin or layman term is the antibody. Layman term of immunoglobulin is antibody which protects against various infections. So it is known as protective protein or defense protein. Again, immunoglobulin are of 5 types, as you know, perhaps. That is immunoglobulin G, IgG, immunoglobulin M, immunoglobulin G, largest portion of the immunoglobulin, gamma globulin. Next is the IgM. Next is the IgA. Next is the IgD. Next is the IgE. GMADE. Largest immunoglobulin, largest means concentration highest. Highest concentration of the immunoglobulins is the immunoglobulin G. M, A, D, E. There are 5 types of immunoglobulin and 5 types of the antibody. These are all proteins present in the plasma. So this is the classification of the plasma protein: albumin, globulin, fibrinogen. Globulin alpha 1, alpha 2, beta, gamma. Beta, you can separate it beta 1, beta 2, but I will not separate here. Now alpha 2, alpha 1 concentration will be more or less 0.4 to 1.4 gram per dl. Total alpha. Beta will be 0.5 to 1.5 gram per dl, and gamma is the greatest portion, 0.8 to 1.8 gram per dl. This is the concentrations of the various proteins present in the plasma. Total concentration being 6 to 8 in gram per dl, not in milligram. Remember, glucose, urea, creatinine, cholesterol, triglyceride, bilirubin, all are expressed in milligram per dl, except 2 important parameters. One is protein, another is hemoglobin, are expressed in gram per dl. Hemoglobin, total protein, albumin, these are expressed in gram per dl. All others are expressed in either milligram per dl or microgram per dl. So this is the classification of the plasma protein. Now I will give some examples of alpha, beta. Now I will describe about the albumin, the major protein. What are the functions of the albumin? Functions of the albumin. Albumin is a simple protein. All other proteins are conjugated protein. Have mentioned here. That is glycoprotein. সমস্ত প্রোটিন যেগুলো আমি বলেছি other than albumin, all the fractions of the proteins, plasma proteins are glycoprotein in nature. That means some carbohydrate is added to it. With exception, albumin, which is totally a protein, not any other. That is amino acid sequence. A tinte major function. Number one and the most important function is the maintenance of osmotic pressure. What is it called? When osmotic pressure is exerted by protein or albumin, it is known as oncotic. Oncotic pressure is nothing but osmotic pressure exerted by mainly albumin. তাহলে maintenance of the osmotic pressure of blood. Now what happens if the osmotic pressure is not maintained? In case of hypoalbuminemia, lower albumin level, lower than normal, particularly less than 2 gram per dl, normal level 3.5 to 5 gram per dl, it will decrease. There are many causes of the decrease I am coming. But what happens when the albumin is decreased or total protein is decreased? There will be osmotic pressure, lowering of the osmotic pressure or lowering of the oncotic pressure. There are two pressures within the blood vessels. One is the oncotic pressure, another is the hydrostatic pressure. Oncotic pressure tries to conserve water. It draws the water from outside, and hydrostatic pressure has opposite effect. It forces out the water to the outside. Outside means to the tissue space. So blood vessel, this is blood vessel. তাহলে এখানে blood আছে. If the water is, when oncotic pressure is low, it cannot counteract hydrostatic pressure. Both oncotic pressure and hydrostatic pressure has opposite action. Oncotic pressure draws it outside. Oncotic pressure ফ্লুইডটাকে নিয়ে আসবে. It prevents the extrusion of the fluid from the blood vessel to the outside. It prevents, oncotic pressure prevents, opposite will be prevented. Opposite will be prevented. But when it is lowered down, it cannot counter, but hydrostatic pressure take exactly opposite effect. Hydrostatic pressure এটা when এই ফ্লুইডটাকে বাইরে নিয়ে আসে, it tends to out the fluid. Hydrostatic pressure tends to out the fluid. Oncotic pressure tends to in the fluid. So when oncotic pressure is lowered due to lowering of albumin, what happens? Fluid will forced to the outside. Fluid will force to the outside. যদি hydrostatic pressure will take upper hand. When oncotic pressure is lowered, hydrostatic pressure will take upper hand. It will out the fluid from the vessel to the outside, that is tissue space. Tissue space or interstitial space. Interstitial space এটাকে বলা হয় interstitial space. If the fluid is accumulated in the interstitial space, it makes a swelling and it is called edema. If the fluid is present in the tissue space, in the interstitial place, in between the cells, there will be a swelling and that is known as edema. So what happens in albumin, lowering of the albumin? That is edema. Edema will occur when the levels of the albumin and proteins are lowered down, and the albumin performs 75 to 80% of the oncotic pressure. 75 to 80% of the oncotic pressure, that is osmotic pressure exerted by the albumin and protein, are due to albumin. So when albumin is lowered down, there will be edema. End result or ultimate clinically manifestation of low albumin level in the blood is nothing but edema, but it will be sufficiently lowered down, less than 2. তাহলে maintenance of the osmotic pressure, and if this cannot be maintained, there will be leakage of the fluid from the blood to the tissue, causing edema. Number 2, transport function. Various molecules are being transport or carrier function carried by albumin. What are the molecules transported or carried by albumin? Many molecules. Yes, one of them is bilirubin. Any other molecule? Very good. Any other molecule? What are the molecules transported by albumin? Physiological substance, তার মধ্যে bilirubin বলেছো, ঠিক? Bilirubin, fatty acid, bilirubin, fatty acids, these are the important biomolecules. এবার কিছু hormones. What are the hormones carried by albumin? Hormones mean thyroid hormone, thyroxine, certain steroid hormone, not all. Certain metals. What are the metals? One is the copper, another is the calcium. Copper and calcium is carried by albumin. In addition to these, there are many drugs which are carried by albumin. What are the drugs carried by albumin? Drugs carried by albumin are, most important drugs is the aspirin, penicillin, sulfur drugs, sulfonamides, these are the drugs which are usually not present in our body unless prescribed. Unless prescribed, it is not present in our body, but these drugs when taken, aspirin, penicillin and sulfonamides, There are lots of drugs carried by albumin. Of these three drugs are very prominent drugs carried by albumin. What are the molecules carried by the albumin? You have to mention all these molecules: fatty acid, bilirubin, thyroxine, steroid hormone, copper, calcium, aspirin, penicillin, sulfonamides. These are all carried by the albumin and the important functions, one of the performed by albumin. Now, next function is the buffer function. All proteins act as a buffer, particularly albumin. Buffer means these are the substances which maintains acid-base balance in our body, which maintains pH of the blood within normal range. These are called buffers. I will take buffers in the next class. Buffer action, and buffer action is due to a amino acid, particular amino acids which causes buffering action. What are the amino acids? It is the basic amino acid, that is histidine. Albumin contains about 585 amino acids. A molecule of albumin is 585 amino acids. Of these, 16 amino acids are histidine, and this histidine plays the buffering action. Histidine has a role in buffering action. All the molecules, all the proteins which is composed by histidine has buffering action. More histidine, more buffering action. These are the three important functions of the albumin, in addition to nutrient function. I am not mentioning here. All of you know that protein has nutrition role, but in addition to these, the three specialized function which is performed by albumin, the major portion of plasma proteins. The major portions of the plasma proteins are albumin. Now, what are the causes of hypoalbuminemia? Albumin এখনো শেষ হয়নি। Albumin বাড়ে খুব কম। Increase of albumin or protein is a very few instance, but lowering of the protein or albumin is a very common in clinical practice. That is hypoalbuminemia, decreased level of the albumin. Or in all cases of the hypoalbuminemia, there is hypoproteinemia. Not in all cases, but majority of the cases. Majority of the cases, hypoalbuminemia is associated with hypoproteinemia. Hypoalbuminemia means decreased albumin level than normal value. Hypoproteinemia means decreased protein level than normal value, that is less than 6 in case of protein. In case of albumin, it is less than 3.5. Hypoalbuminemia is mostly associated with hypoproteinemia, not on all cases. Now, what are the causes? First of all, I will tell what are the sites of these protein synthesis. Protein synthesis occurs mainly in the liver, with exception, all the proteins I have mentioned are synthesized in one organ, that is liver, with exception immunoglobulins. With exceptions, immunoglobulins which are synthesized by reticuloendothelial cells, plasma cells and lymphoid tissue. With exception of the immunoglobulins, remember, majority of the plasma proteins, majority of the proteins in our body are synthesized from liver. So, any disease of the liver, any diseases of the liver may produce hypoalbuminemia. তাহলে নাম্বার 1 হচ্ছে গিয়ে liver diseases. What are the important liver diseases? Particularly, the disease name of the disease is the cirrhosis of liver. The cirrhosis of liver, very important disease of the liver, which is produced by many factors, particularly alcohol. Cirrhosis liver is the most important cause of hypoalbuminemia because liver is damaged here and liver cannot synthesize albumin. তাহলে decrease synthesis, এটা হচ্ছে decrease synthesis. Decrease synthesis in liver disease produces, particularly the disorder is the cirrhosis of liver, produces prominent hypoalbuminemia. Prominent hypoalbuminemia in the liver disease, name of the disease is the cirrhosis of liver, produces hypoalbuminemia as well as hypoproteinemia. Now, your liver is okay, but you do not take protein, as in undernutrition. Undernutrition, you do not take protein. Undernutrition is another cause of, particularly in our country, in rural area, undernutrition is a very common problem, and the undernutrition will cause hypoalbuminemia. Inadequate intake, here is decreased synthesis, এখানে হচ্ছে inadequate intake. Inadequate intake of protein. Among the name of the undernutrition, the disease produced by the undernutrition, prominent disease, ওখানে যেমন cirrhosis of liver, here is the prominent disease, is the kwashiorkor. This terminology you will have to familiar. Kwashiorkor. Kwashiorkor is a disease produced by undernutrition, particularly deficiency of the protein. Deficiency of the protein in diet will produce a disease known as kwashiorkor, a variety of undernutrition. There are two varieties of the undernutrition. One is the marasmus, another is the kwashiorkor. And the most prominent edema, most prominent hypoalbuminemia occurs in kwashiorkor. তাহলে এগুলো কিন্তু সবগুলো কিন্তু ইডিমা হবে। All the diseases, all the causes of hypoalbuminemia or hypoproteinemia will be manifested clinically by formation of edema. And edema কোথায় দেখা হয়? Edema is examined in the ankle. You will put a pressure, put your thumb over the ankle, put your thumb over the ankle, press it, release it, you will find a pit. You will find a pit. Press the thumb, release it, you will find a pit. That is the sign of edema. And here all the diseases I will mention here is manifested by edema. Number 3, liver is okay. You are taking protein sufficiently, but protein is leaked outside through the kidney. Protein is excreted, particularly albumin. Albumin is excreted through the kidney, massive albuminuria. In that case, there will be hypoalbuminemia. protein in the massive protein in the urine means low protein in the blood. Massive protein in the urine means low protein, low albumin in blood. তাহলে increased excretion, increased excretion through urine. It can be excreted through gut also. When it is excreted through urine, a particular disease, nephrotic syndrome, diseases of the kidney will cause excretion of the albumin through the urine, and the massive proteinuria or massive albuminuria occurs in a disease. The name of the disease you have to mention, that is nephrotic syndrome. Nephrotic syndrome. Nephrotic syndrome is associated with massive albuminuria. Globulin cannot pass through the urine because globulin is a large molecule. Albumin being the small molecule passes through the glomerulus. Increased excretion through the urine, that is one disease is the nephrotic syndrome, যেখানে 3 gram albumin is lost. 3 gram of albumin is lost per day, at least 3 gram of albumin, not less than 3 gram albumin. At least 3 gram of urine or it more amount of the albumin when passed through the urine per day, it is called nephrotic syndrome. There are other characteristics of the nephrotic syndrome. Nephrotic syndrome means massive protein albuminuria, hypoalbuminemia, and another feature is the hypercholesterolemia. These are the 3 cardinal signs of nephrotic syndrome: massive albuminuria, more than 3 gram per day. Number 2, hypoalbuminemia, it is the result of massive albuminuria, and hypercholesterolemia. All these 3 things are present in the nephrotic syndrome. Now, another causes of the is the you are taking protein sufficiently, your liver is okay, your kidney is okay, there is no liver disease, no kidney disease, taking এই 3টে condition আসছে না, liver is okay, diet is okay, kidney is okay, in spite there may be albuminuria, that is malabsorption syndrome. You are taking protein but it is not absorbed, it is not going to your body, that is called malabsorption syndrome. Here you will get hypoalbuminemia. Malabsorption syndrome. Next is the protein you are taking regularly. Protein is synthesized in your body, but there is a increased breakdown of the protein, increased catabolism of the protein may occur in certain diseases. There is also another cause of hypoalbuminemia. তাহলে কি হলো? Decreased synthesis, cirrhosis of liver, increased excretion, nephrotic syndrome, undernutrition, increased inadequate intake, kwashiorkor, and defective absorption of the protein is the malabsorption syndrome. It may cause hypoalbuminemia. So these are the causes of the hypoalbuminemia. and also increased catabolism. What are the increased catabolism? মানে হচ্ছে যেখানে increased breakdown of the protein. Increased catabolism কোথায় হয়, কখন হয়? Increased catabolism when occurs কতগুলো ডিজিজ, যেমন হাই ফিভার, diabetes mellitus, cancer, many causes of increased catabolism. তার মধ্যে হাই ফিভার, ক্যান্সার, ডায়াবেটিস, থাইরোটক্সিকোসিস, these are the important causes of the increased catabolism, increased breakdown of the protein, which may cause hypoalbuminemia. That these are the causes of hypoalbuminemia, and why hypoalbuminemia occurs I have explained. Now, what are the example of the alpha-1 globulin? Alpha-1 globulin, alpha-2 globulin আছে, beta globulin আর gamma globulin আমি বলেছি। Gamma globulin, there are 5 types. For immunoglobulins, there will be separate class of immunoglobulin, structure of the immunoglobulins. Example of the alpha-1 globulin. Alpha-1 বলো, antitrypsin পড়েছো এটা? আর কি কি আছে? What is the importance of the alpha-1 antitrypsin? What is the importance? How it occurs in deficiency of this protein? It is present, this protein is mainly present in the lung tissue, and elasticity of the lung is preserved by this enzyme or protein. So elasticity of the lung will be lost in absence or deficiency of alpha-1 antitrypsin, and that is caused emphysema. Emphysema of the lung occurs in deficiency of alpha-1 antitrypsin, which is a globular example of alpha-1 globulin. তাহলে আমি লিখছি না, এটা হচ্ছে deficiency will cause emphysema. মনে রাখবে এই টার্মটা। Emphysema is a disorder present occurring in the lung, where lung will be enlarged, losing elasticity. That is emphysema. Alpha-1 phytoprotein, it is a tumor marker. It is increased in various cancer. Tumor marker increased in various cancers. এটা decrease করবে emphysemaতে. This will increase in cancer. This is an example of, prominent example of the alpha-1 globulin. আবার alpha-1 lipoprotein, that is HDL, alpha-1 lipoprotein. These are the example of the alpha-1 globulin. Another আরো অনেক প্রোটিন আছে, thyroxine binding globulin, cortisol binding globulin, retinol binding protein, all are the examples of alpha-1. Alpha-2, এটা হচ্ছে alpha-1. Alpha-2 এর এক্সাম্পল হচ্ছে, মোস্ট এক্সাম্পল হচ্ছে হ্যাপ্টোগ্লোবিন। Haptoglobin, which is a binding protein, it binds hemoglobin. Hemoglobin other যদি bind না করে তাহলে কি হবে? It will pass through the urine, but it is not prevented. Leakage of the hemoglobin is prevented by the molecule haptoglobin. Haptoglobin binds with hemoglobin and conserves hemoglobin, conserves iron. Haptoglobin and ceruloplasmin, very important protein. Ceruloplasmin is a alpha 2 globulin, it carries copper. আগে আমি বলেছি অ্যালবুমিন কপার ক্যারি করে, বাট ইট ইজ 10%. 90% of the copper is carried by ceruloplasmin. 10% of the copper is carried by albumin. Ceruloplasmin is a copper binding protein, copper carrying protein. The deficiency of ceruloplasmin, deficiency of the ceruloplasmin causes a disease. Disease cause kore, it is a sign of a disease. Deficiency of ceruloplasmin is a sign of a disease, and the name of the disease is the Wilson's disease. Ceruloplasmin deficiency holo pore, the disease is called Wilson's disease. Wilson's disease, the low ceruloplasmin in Wilson's disease. I am not describing disease. Beta globulin example, beta globulin example হচ্ছে transferrin, iron carry করে. Transferrin is a protein, beta globulin in nature, which carries the iron. Transferrin or hemopexin, it carries the heme, not hemoglobin. Hemopexin binds with heme, and total hemoglobin is bounded by haptoglobin. Haptoglobin binds with total hemoglobin, both heme and globin, and hemopexin binds with only heme. This hemopexin and transferrin are beta globulin, examples of the proteins. Aro onek example ache, I am giving the prominent example. Prominent examples and classifications of the plasma proteins. I have described major functions of the proteins, particularly albumin I have described, এবং major function of the specific proteins I have mentioned. Next is the, এটা বলি আমি শেষ করে দেবো, যেটা হচ্ছে অ্যাকিউট ফেজ রিঅ্যাক্ট্যান্ট, যেটা ক্লিনিশিয়ানরা খুব বেশি ব্যবহার করে। অ্যাকিউট ফেজ প্রোটিনস, হোয়াট ইজ দিস? অ্যাকিউট ফেজ প্রোটিনস, কেউ কেউ বলে অ্যাকিউট ফেজ রিঅ্যাক্ট্যান্টস। Acute phase proteins or acute phase reactants are certain proteins which are increased in response to injury, inflammation or infection, trauma and surgery. তাহলে these are raised, these proteins are raised in response to injury, inflammation, inflammation, infection, particularly bacterial infection. When a clinician is suspecting any sorts of infections, but clinically it is not any manifestation, there is no clinical manifestation of the infection like fever or leukocytosis, then clinicians perform acute phase reactants to ascertain whether there is an occult infection is present or not. Whether there is an occult infection is present or not, it is judged by the estimation of the acute phase reactants or acute phase proteins which are raised in response to infection. What are those proteins? Very common proteins, সবসময় আসে হয় C reactive protein, CRP, transferrin, even fibrinogen, the clotting protein, ferritin. Ferritin is a storage form of the iron, storage protein. CRP, transferrin, fibrinogen, ferritin, and lots of protein. These are the common proteins. Very common is the CRP, that means C reactive protein. C means C. ক্যাপসুল থেকে সি এসছে, নিউমোকক্কাল ক্যাপসুল থেকে সি এসছে, আর হচ্ছে রিঅ্যাক্টিভ, পি হচ্ছে প্রোটিন। সি রিঅ্যাক্টিভ প্রোটিন is a very, very important parameter which is raised in response to injury or inflammation or infection. Less than 1 milligram per DL normally, কিন্তু এটা several thousands বেড়ে যায়, প্রায় 100 গুণ, 200 গুণ, 1000 গুণ পর্যন্ত বেড়ে যাবে। These are called acute phase reactants or acute phase proteins which are used for clinical purpose to ascertain whether there is an infection or not. This is all about the plasma proteins or acute phase reactants. Very important topics and very important topics for Viva